Know when we're live.
We're live. Hello. Welcome. Saturday morning. Saturday afternoon. It is May 23rd. This beautiful Saturday, depending on where you are, but it's a beautiful Saturday regardless to be here. It is the OCD Town Hall for Teens. Clearly, I am a teen, along with Shira and Kyle, and then we have our older sisters, Robin and Lisa. We're all very excited to have an awesome panel for you today. So in the meantime, as always, we'd like to give a couple minutes for you to come on in, say hello, let us know where you're from. So definitely give a shout out, say hi, and let us know where you're tuning in from, and we'll get started in just a couple of minutes. But this is a special town hall with some really special guests and some special folks. So hi, Anna, how do we tune in? I think you're tuned in. There's Stephanie from France. Hello, Stephanie. She lives in Nice near Cannes. I think that we should all go visit her. So Stephanie, get ready. We're all coming. What up, Sean? Stufflet's Loud. Yay, Lisa from Boston. Sean Shinnick, everyone from Draw Your Monster. Artist extraordinaire. Check him out on Instagram. A really, really good guy and a dear friend. Hi, Brent. Good to see you. There's Jelly from Florida. What up, Jelly? Anna is in San Diego. How's everything in San Diego? Hello.
I'm getting some texts from people that are saying they're having trouble finding the link. Do they just go to the IOCDF?
Yeah, if they just go to the IOCDF Facebook page or YouTube page, they'll see and if they don't see it on the page, they can click on live videos.
Okay.
Ooh, Stephanie said when you won. So guys, trip to France. We're in. There's Deirdre from Swansea, Malia from Seattle, Carlo from Rhode Island. We have Marty and Boca. All right, we're just 10 seconds away from getting started here. Continue to say hello. Let people get loaded in. It always takes a few minutes. There's traffic. It's fine. All right. It's been 2 minutes and 30 seconds to try to get this baby started and reward those of you that were on time and didn't miss the bus, though, of course, all are welcome to continue to join in. What's up, Natalie in Toronto, Heidi in North Carolina. My name is Ethan. I'm the National Ambassador for the International OCD Foundation, which simply means I have OCD, and I like to talk about it a lot. Although lately I've just been asking a lot of questions. This is the OCD Town Hall for Teens, which means that this is for teens. I thought we'd be really descriptive in the title to be clear about what this is about. Let me get through some super quick housekeeping, and then I'll read off some basic guidelines and instructions, and then we'll get rolling right into you. This is for you. So quickly, this town hall is intended to serve as educational content and not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. The International OCD Foundation is not a crisis hotline and should not be used if you are in distress or feel unsafe. If you are in a crisis or you're ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. As always, I encourage everyone on the stream to be respectful and kind to others. We try to create as safe a space as possible, but this is a public forum. This is being recorded for everyone to enjoy after the live event. So always keep in mind of that and divulge only what you're comfortable. But again, we try to create as safe a space as possible to be supportive of everyone and supportive of each other. Finally, a little added bonus, if you will. Again, this is a teen town hall. We have two amazing teens on the panel. And so we want to keep this as family friendly as possible. We are open to answering any and all questions about OCD, but know that this is geared toward teens and families. If you are watching, you are not a teen or a family, but you do have questions, definitely feel free to ask. But again, if they're of the graphic nature, try to be mindful of that and what everybody here is reading or seeing. Yes? Good? Okay, cool. Let's roll on. If you're just joining us, welcome to the OCD Town Hall for Teens. My name is Ethan. We have an amazing guest. We have amazing guests with you. And so without further ado, let me introduce the peeps that we'll be talking to. I've been into that word peeps lately. I don't know why. Ever since Easter, I suppose. Peep. Who likes peeps? I love peeps. It's really delicious. So just to my, it's always reversed on camera, and I never get it right. So yeah, nope. See, even you, no. Just to my, just the highlighter in yellow. Yep. We have Dr. Robin Zasio. She is the director of the Anxiety Treatment Center of Sacramento and Roseville, California, the Center for Depression and Treatment-Resistant Symptoms, the director of the Compulsive Hoarding Center, and the director of the Cognitive Behavioral Therapy Center. That's a lot of centers, Robin.
Staying busy, I'll tell you what.
Yeah, for sure. She's the host of the Dr. Robin Zasio show on AM 1380 and Mental Health Matters, iHeartRadio. She's the author of The Hoarder in You, How to Live a Happier, Healthier, Uncluttered Life. She's one of the featured doctors on Hoarders, the Emmy-nominated A&E hit series. Host of My Extreme Animal Phobia on Animal Planet and Discovery Channel. She proudly serves on the Scientific Advisory Board, the Clinical Advisory Board, the Speakers Bureau, the BTTI faculty, the Conference Planning Committee member of the IOCDF, and is the president of the OCD Sacramento Foundation. So, Dr. Zasio, thank you so much for being here.
Thank you.
Yeah, absolutely. To Dr. Zasio's left or right, depending on, well, let's go with doctors first, then we'll get to our young lads, if you will. So just below me is the our dear friend of the show, Dr. Lisa Coyne. She's the founder and senior clinical consultant of the McLean OCD Institute for Children and Adolescents at McLean Hospital, and is an assistant professor at Harvard Medical School. She is the founder and director of the New England Center for OCD and Anxiety, and is on the faculty of the Behavioral Therapy Training Institute, BTTI, of the International OCD Foundation. She is also a licensed psychologist and peer-reviewed ACT or Acceptance Commitment Therapy trainer. She has authored multiple articles and chapters on ACT with children and adolescents, and is a co-author of the books Acceptance and Commitment Therapy, A Clinician's Guide for Supporting Parents and the Joy of Parenting. Her new books, The ACT Guide to Teen Anxiety OCD, and most recently, Stuff That's Loud, A Teen's Guide to Unspiraling When OCD Gets Noisy, which just released a couple weeks ago in the US and is soon to be released worldwide. It's a really awesome book. So thank you, Lisa, for being with us.
My pleasure. Lovely to be here. Hi, everybody.
Thank you. All right, so getting to our grand special guest, if you will. Ladies first, of course. I am a gentleman. So Shira Folberg, just to our bottom right, is an OCD advocate and IOCDF youth ambassador. She's the creator of the blog Faces and OCD with the IOCDF, as well as her personal blog, Colleges, Collages, and Controlling Compulsions, on Substack. She is a fan of alliteration, clearly. She is currently taking a gap year after earned her GED last summer. Shira plans to attend a Cornell in Mount Vernon, Iowa this fall to study writing, politics, and psychology. Shira, what's up?
Hey.
So glad to have you.
You were better this time with the alliteration. I felt like you were getting smoother with it. Yeah.
Was I? Okay, thank you. Yeah. I appreciate that. Any reassurance from Shira is good reassurance, so I'll take that.
I appreciate reassurances here. That's what I'm going to do this whole time.
I appreciate that. Yeah. Shira is a new friend of mine, but I'm excited to have met her. She's a really rad person, and I'm excited that she's part of the community and doing all the amazing things that she does. Last but certainly not least, a young man that I have known for at least 5 years. Above us, Kyle King. Kyle's a graduating high school senior living in South Florida. He is also very humble, so I made him add he will be attending Yale University in the fall. Mm-hmm. Since recovering from OCD in eighth grade, he's had a passion for why is that French, Kyle? What do you have a passion for? What is it? It says, "Hey, Rosien."
It's supposed to say neuroscience.
I guess neuroscience.
Yeah.
I think something auto-corrected because it's totally French.
I'm really good at Nice, Ethan. I'm just getting ready.
Yeah. It's like he has a passion. I thought Hey Rosien is some cool French TV show on some random channel. Let me restart. Sorry for everybody who's watching. Since recovering from OCD in the eighth grade, he's had a passion for neuroscience and plans to major in the subject in college, which is Yale, incidentally. Aside from his work with the IOCDF, Kyle serves as the UNICEF USA National Counsel and is the president of his school's UNICEF club. He's also an ambassador for the IOCDF. So, Kyle, thank you so much for being here, man.
Glad to be here. Nice to see you again.
Absolutely. All right. So, first things first. I just want to get some thoughts I really don't have specific thoughts. Let's start with Kyle and Shira. Shira, again, since you gave me reassurance, we'll start with you. Kyle, you're on the back burner for a minute. Shira, how are you're a teenager? No, how are things going for you? How have you been coping with everything going on? What's the latest in your life? Give us a little insight.
I mean, right now, things honestly I feel like are going for me as well as they could be going. I'm actually just finishing up with an IOP through Houston OCD. Like I always say, like recovery is not something that's linear. And I'd like to be transparent about that. Things are doing well, and I honestly think that I'm the highest functioning I've been since I was about 9 years old. But I think that I feel good about the work I'm continuing to do. And I'm really, really grateful to be here today.
Awesome, Shira. Thank you. Yeah, it was completely random. I was a guest speaker.
Yeah, I officially met Ethan. He was a guest speaker for our group, our virtual IOP group.
And then suddenly, a week later, you and I were like collaborating on 50 things and had no idea. So
I've attended your conference panels and such in the past, but I'm not going to hold it against you that you don't remember me.
What? Lisa loves Shira. Whatever, Lisa. Be quiet. Okay, next we have.
She is good.
Lisa loves Shira. That sounds like a new reality show.
Lisa loves Shira. I can write the song. Kyle, how are you doing, man? How's everything going? Listen, I know actually. Let me bring something up. You can definitely fill us in on what were you thinking. Don't mute yourself. Don't have some confidence, man. We want to hear your background noise is important to all of us.
This is my dog snoring.
That's all right. That's all right. So quickly, in addition to final thoughts, this was your graduation year.
It was.
So you had to graduate virtually as many of. So fill us in a little bit on whatever you wanted to say before, and then take us a little bit through how this last few months have been.
So just personally with my OCD, I've been doing much better recently. I have been noticing that, like, as I have been moving towards college, I've been having some anxieties, and I've seen like little contamination things come up here and there. But I like getting kind of refreshed because it reminds me to like stay on top of OCD because it can pop up whenever. But yeah, graduation this year's it's interesting. I was looking forward to, like the classic prom and kind of all the things that come with being a graduating senior. Sorry about that. But we're making it work.
All right, cool. Dr. Zasio, how's everything in your life? What's the latest and greatest? How are you doing?
Everything's good, Ethan. And again, I just have to give a shout out to you. I don't even know how many hours you put in a week doing these town halls, but it's an honor to be here. It's an honor to be connected to the IOCDF and the incredible movement that's happening. And I just want to say one thing. If people are just tuning in for the first time, you're not familiar with the IOCDF, it is the largest national organization promoting proper treatment for OCD and anxiety disorders. And go to their website because there's so much information. There are so many town halls. I mean, Ethan, how many have you done so far? Do you know?
Probably 40 or 50, maybe.
Yeah. So, I mean, you have an opportunity, if you're tuning in, to talk to the top experts in the country who are volunteering their time to share with you their expertise and what you can do, not only during COVID, but just as you're struggling with OCD and anxiety disorders. And my gosh, Kyle and Shira, a testimony to the two of you for being so transparent and willing to be so vulnerable to the entire world. I mean, literally, IOCDF has a worldwide following, and it's an honor to be a part of this teen group because we are seeing a huge influx of teens over time at the Anxiety Treatment Center. And I think the one thing that for me is so frustrating is when I get a call from a parent who says, my child is really suffering with OCD, and they'll go on to tell me the level of impairment, and you can see the symptoms increasing. And then I'll talk about the options for treatment. And, if they're more in the moderate to severe, I'll recommend considering IOP like you're doing, Shira. And then they'll say, oh, no, we can't do that. We can't take them out of school. I'm really looking more for the summertime, and I'm thinking, oh, they really have not educated themselves to understand that, one, the condition is going to progress, and then things are going to be so much different, even if they can stay in school at this point. And two, that it is better to get help early on so that you can work towards reducing those symptoms so they can actually function in school. And my gosh, Kyle, what a testament. You are going to Yale. And this just speaks to the power of early intervention, ERP, and being willing to say, you know what, I've got to put everything else on hold to take care of me. And I'll tell people, I would so much rather lose a leg than my mind, because you can still walk without a leg. But once OCD takes over, it's a whole nother galaxy. And I don't have OCD, but my gosh, Ethan, you've been transparent as well about the impact of OCD on your life. And we have so many people involved in the IOCDF who have either struggled or been through treatment. And, it just doesn't get any better than that when we can have kind of these individuals who are willing to say, this is what it looks like, versus the professionals who say, I know exactly what it looks like, but we haven't actually suffered from it. So an honor to be here, and super excited to have this forum to be able to help others who just need to get more information. And hopefully through, the things that Lisa and I talk about as doctors, and Shira and Kyle talk about as individuals who are struggling, that this will motivate people and parents who are scared to get treatment to be willing to reach out and seek help.
For sure. Thank you so much, Robin, for the very kind words. We're equally excited to always have you and all your contributions to the OCD community, to the hoarding community, to all the communities that you involve yourself. So we're equally as grateful, and thank you so much for the kind words. Incidentally, somebody asked, what is IOP? It stands for Intensive Outpatient Program. So essentially, it's a little bit more intense than once a week. You might go 3 or 4 times a week, or even 5 times a week for so many hours a day. But it is not sleepover, which is residential, where you're 24/7 care. That's essentially the gist of it. So, and you actually reminded me of something, and I'm going to get back to Shira and Kyle in a minute. But of course, certainly, and last but not least, Lisa Coyne, who has joined us on a few of these. We always love her. Lisa, how are you? What's going on? What are you seeing?
I am good. It's rainy here in Boston. Which
Take yourself off mute. Oh, there you are. Okay,
I'm off mute. I think I'm off mute. I'm good. It's rainy here in Boston, and as always, I want to echo everything Robin. I just want to say what she said to what Robin said. I agree with her completely. It's always an honor to be here, and if I would add anything, I would just say, Shira and Kyle, you guys inspire me, and I think one of the things that I hope comes from these for the community is, that you're giving them a gift, really, in helping break down barriers, right? And, helping destigmatize, when people are struggling with anxiety or OCD or whatever it is, because we all have our stuff that we struggle with. And this is a space for the people who are listening. If you are a teenager or a parent, we are trying to create sort of these safe spaces where you guys can talk about things that are hard to talk about. And if you don't have access to care, this is a great way to start getting really, really good information. So I'm always happy to participate in these. And, Ethan, you're wonderful. I love this work that you do too. And I guess that's all I'll say for now. Is that okay?
That's totally okay. Absolutely.
Okay.
We are a yes and group. So yes,
All
that
right.
is totally okay. For sure. By the way, if you're watching and parents of teenagers that feel like they could benefit from this, please feel free to share the stream on Facebook or YouTube. Let them know this is going on right now. We know we get lots and lots of emails wanting this kind of content. So please let them know this is available. And again, it will be recorded on repeat. So as always, also, we will be having a Q&A. I always say we'll answer all the questions. We never get to all the questions. So get your questions in early. Those will be answered for sure. But we will always do our best to work our way through the questions. So feel free to drop some questions in. We will get to them momentarily. I'm actually going to start now with Kyle. quickly, there was a question, and I think this is Robin made a point about early intervention. Lisa did too, or everybody did, the two. But anyway, clearly I was listening. So Kyle, somebody actually asked, hey, I'm from Florida. Where did you get treatment? So before you answer that, your story is very interesting. It was such an aggressive onset of OCD and how quickly you spiraled out. And so just quickly, can you give us a little bit of background on your journey? And then we'll turn to Shira and ask her the same question.
Yeah, of course. So going into 7th grade, I started to have little fears about contamination. I would like put books from the library in bags so I didn't have to touch them. But it wasn't anything too crazy. And then I went to school one day and I had one trigger. And then from that one trigger, everything spiraled out of control. And I would say within about 2 months, I went from being normal functioning to sitting in my room and not being able to come outside or touch anything in my house or look at my TV or touch my phone or talk to my friends. My life was just completely taken from me, faster than I or my parents could get our heads around what was happening. So when I was like kind of sedentary and wasn't able to continue living, that's when my parents were like, okay, something's wrong. So they forced me to go to the NBI, the Neurobehavioral Institute, I think that's what it stands for, in Weston, Florida. And that's when I started treatment, but I don't really think that I fully accepted what disorder I had and what the treatment was for about like a month or two. I was kind of begrudgingly going through exposures and then going home and secretly undoing them, which I think a lot of people probably struggle with. And then it just kind of hit a bottom, and my life was so upside down, and I didn't have anything that I felt like I was living for. And that's when kind of the fight became very real for me, and I had to turn it on and really get aggressive towards my OCD. And then actually, Ethan, I don't know if you know this part of my story, but I kind of had a relapse last year in junior year of high school. And I had a very aggressive onset of anorexia, which is related to OCD. And that also took me out of school. I had to drop everything. Robin, this goes to your point. I'm a like perfectionistic school type person. I'm very into grades. And my parents, they sat me down one night and they told me that I had to come out of school and deal with this anorexia. And I couldn't take that fact. But everyone around me told me that it was a good idea to kind of drop my books and just for a month or two go to IOP and really work on myself. And I'm so grateful that I did, because I don't think I'd be here today if I didn't kind of prioritize my mental health and get myself back on track.
I appreciate you sharing that, Kyle. I did not know that, and I'm sorry you went through that, but I'm not surprised that you came out the other end either. You're a real testament to engaging in treatment and therapy, as Shira is as well, especially at an age where it's very easy to just say, oh, I've got plenty of time, I can deal with it, you know. So kudos to you, Kyle. Very quickly, because I'm just scanning some quick questions. What specifically kind of treatment was helpful for you in dealing with your OCD?
So my favorite kind of treatment was like very route aggressive, like do the exposure. Like I'm a big believer in like, all right, you have this goal and you're going to do this exposure and you're going to like want to feel the uncomfort and really like get mad at your OCD. I remember when I was at the worst of it, and this is probably a function of Dr. Moritz, who Ethan, you know, is like very intense.
I called her like the ERP Hitler. She was my therapist, and that's how I got connected with Kyle, because I too, NBI was the first place that I went to before my journey took off. So we share some people in that. Go ahead, Kyle.
I would externalize my OCD first, and then I would like put on some Eminem, start blaring some like really hype music, and I would get visually upset at my OCD and want to like beat it up almost. And every time I got anxious, I would be happy because I felt like I knew I was making it more scared than it was making me scared. It became like a fight, and it was fun.
I love that. Dr. Zasio, so I see a couple questions and people are asking, what is the treatment for teens and OCD or adolescents, and, obviously it doesn't differ from adults or kids. So I'd like you to speak quickly to what is the gold standard treatment for OCD in adolescents, and just a little bit to that.
Of course. And Ethan, I'm so glad you pointed out that the treatment really doesn't change depending on your age. We have a 6-year-old that we're working with right now who's terrified that something bad is going to happen to her mother. And she is doing swimmingly, doing IOP treatment. And so I think on that, I'll send a shout out to, there's not any age at which someone can start to do ERP. I worked with a 3.5-year-old that had trichotillomania and did amazing through treatment. So ERP, of course, is exposure and response prevention. And essentially what we're doing is, we're basically acknowledging that people are fearful of things that they don't need to be fearful of. And OCD lives in the same system that keeps us safe in the real world. We have our amygdala that's firing off, telling people with OCD to be scared and frightened and to flight instead of fight, and to run from the trigger. And of course, the more you run from what you're afraid of, it's going to chase you, man. It's right behind you. And Kyle and Shira, you know that. And the OCD just keeps getting worse the more that you flight. So ERP is, a treatment that allows people to very systematically help them to start confronting their fears. Now, there's a lot of stories out there about people who have been flooded with ERP, and there's different ideas from different therapists about, what ERP should look like in terms of that hierarchy. I'm of the mind that we start low, we get an anxiety rating scale, and, work our way up, because your brain has to process what it's starting to confront, and it has to desensitize to these things that the person's been avoiding. And, there really isn't anything cool about OCD. I mean, that's the bottom line. I mean, how many people have had perfectionism who've said, oh my gosh, oh no, it's been so good for me, but yet they're paralyzed and they can't move forward because they're so afraid of not doing things perfectly. At the same time, there's only one good thing about OCD, and that is there's treatment for it. And if you guys are listening right now and you're suffering and you're afraid that, this is what your life is going to look like, contact Kyle, contact Shira, because they are testimony that life is getting better. Shira started at 9 years old and she's at the best she's been. Again, I'm just going to reiterate, Kyle's going to Yale. I mean, come on, So there is treatment out there. There's lots of providers out there. I'm going to send a shout out again to the IOCDF, where there's a provider database. You can put in your zip code, your location, and see if there's somebody in your area. And if not, call the IOCDF, because there may be other resources that you're not aware of where you can get help. But, kind of going back to stories about people being afraid of doing ERP, it's tough. And, we can maybe send a question out to Shira and Kyle about that again. It's not easy. And as therapists, Lisa and I every day have to do this kind of slow torture to our patients. And it can be really painful on our end to have to ask people to do things that are so scary and so frightening, and they're so scared that what they're going to do is actually going to happen. But that's the beauty in it, is we don't really believe it's going to happen, which is why Lisa and I are not in jail or lost our licenses, is because we can ask people to do these things that will help them to see, and their brain, more importantly, that they don't have to keep signaling them danger.
Thank you, Dr. Zasio. I appreciate that. So Shira.
Hello.
It like that. Shira, give us a little bit about your story and your experience.
Yeah, so I was diagnosed when I was 9, and when my OCD first got pretty bad, it manifested as disordered eating. But it wasn't it wasn't related to weight at all. It was a bunch of ritualizing around food itself, and the actual around meals, and very controlling. I was very focused on controlling portions, and that resulted in a dramatic change in my weight very quickly. And I was lucky enough to have access to a provider who did ERP treatment. My psychiatrist diagnosed me because I had a ritual where I would time my meals. So she connected the time ritual to OCD, and that's how I was diagnosed. And that sort of got me over my first really big bout of OCD. And I functioned pretty well. I had OCD waxing and waning throughout the years, but I was functioning. And then when I got to high school, things kind of escalated. When I was 16 was when things got pretty bad. Like Kyle, maybe not quite as fast, but things escalated for me pretty quickly. When I was 16 was when things got pretty much the worst they've ever been. Like Kyle, I was housebound. I focused. My biggest issue was moral scrupulosity. So I was basically having all these thoughts telling me, which is something I still struggle with continually, just to be transparent. Thoughts telling me that I was a really bad person, and so I kind of had these thoughts about feeling like I needed to punish myself, stay inside, and I essentially lay on the floor for most of the afternoon. Was lucky enough to have met Lisa through the IOCDF conference, the annual conference. She actually sent a call or called my parents and talked to me on the phone, and she was like, "Listen, like, you need to do this. Like, if you want your life to get better, you need to go to residential." So that's what I did. I went to residential spring of 2018, and that honestly changed my life. If anybody ever wants to talk about residential, who's having doubts about it and who thinks it might be right for them, I would be happy to talk and speak to them. I'll give my email out later. But yeah, after 3 months there, I mean, I was back to functioning. I will add that OCD, it is up and down, and I did miss my entire junior year of high school. After returning to school, I had some difficulties socially and decided, like I'm trying to figure out how to phrase this in a way. School was rough for me, and I think it's really important to articulate the importance of prioritizing mental health over school. If there are any parents out there who are struggling with that, I would really like to articulate that mental health should always be your top priority. To sort of jump to what I'm trying to say, I ended up getting a GED. I never graduated high school. I'm still going to college. I got into school. I'm starting college next year. I'm going to a good school. And yeah, I mean, right now I'm doing well. Like I said, I am in an IOP because maintenance is important. That's the thing with OCD. It's like any chronic illness. It needs maintenance over time. You can't expect to have one round of treatment and then have it go away forever. It requires maintenance. But yeah, I'm doing well now. I lost the initial question.
You answered the initial question.
Awesome.
Yeah.
I'm nervous. This is a huge exposure for me, so I really appreciate all the support.
Absolutely. Well, we're glad we can ERP you.
Thank you.
You know, honestly, Shira, I look back. I mean, I'm having a range of emotions. I'm not going to cry. I'm feeling emotional right now, but like, it means a lot. It means a lot to have you and Kyle on, only because to see teenagers or kids in general that have gotten help and treatment and that are thriving, doesn't matter if it's waxing or waning, doesn't matter if there's ups and downs. That's the nature of OCD, and we all go through it, right? But to be able to be here today and talking about your experiences and showing that there is a way through is really meaningful to me, because I mean, I didn't get treatment until I was 31. We looked everywhere for 17 years. I had OCD since birth. I was diagnosed at 14. And advocacy, yes, is a way to keep my mental health in check, but it is also a way that I make sense out of the years that I lost. And even just like, we have a long way to go as advocates. 10 years is too long for anybody from diagnosis to treatment. But to even see teenagers that have gotten treatment and are moving forward and have their lives ahead of them is so meaningful to me, because I know that the work we're doing, we concentrate a lot on we have so much to do, but like, we also have to point out the bright spots, right? And the things that we have done that have been effective. And like, both you and Kyle are testaments to the fact that it has gotten better. It's by no means perfect. We have a long way to go, but like, Kyle, you got treatment relatively quickly from when you were diagnosed. Shira, it should never be years, it should be days, but even so, like, you are both testaments that the fact that we are making progress. And I think that's huge and needs to be pointed out. So it's very meaningful that you guys are here and telling your stories. Lisa, so I will now turn to you. Now, I know, if you don't mind me saying, obviously you and Shira have a special connection. So anything to add on what Shira talked about, the importance of I think knowing you, you have some thoughts mulling around, so I'd be interested to know what you're thinking.
I do. My mind's always working. So the first thing I want to say is that I really appreciate, Shira, you and Kyle sharing. It's really important. And I think that you've discovered through your own paths that you have a lot of strength. And one of the things I want, if there are teens out there who are listening, or their parents or kids, whoever, and you're doubting that you can get through this, here's the thing. OCD will lie to you and it will tell you that you can't. That's one of its tricks. You have reserves that you couldn't even imagine the strength, right? And so there's two things I just wanted to add to what you guys have all said. I think that it's really important to know that when you do ERP, right, when you go through exposure and response prevention treatment, yes, it's hard, but it is no harder than what you're already walking through, right? This stuff lives with you every day. So it's pain with a purpose. That's one thing to know. And the other thing is, when you go through it, it's not like you do it just if people are new to it and you're thinking, oh, I can do a treatment and I'll be done. No, what it is you're going to shift the way you live, right? You're going to have a different philosophy of living. So when you hit hard stuff, scary stuff, disgusting stuff, uncomfortable, uncertain, incomplete, whatever it is, stuff, you have an opportunity to either run or you move through it. And that stuff, like Shira said, and Kyle, is going to come up and down through your life, right? And the more you choose to lean into it and do the stuff that you care about anyway, the weaker it's going to get, and it's going to be on the retreat. So that's something that's really important to know. So just to kind of add those two things, I think that's it. I'm sure I had another thought, but I feel like my brain is not working today.
That's okay.
I have to change it out, get a different one. I don't know.
Sure. Well, if you think of it, make a note, and we'll definitely get back to it.
Okay.
Shira, I just remembered actually what I was going to say right after you finished, and that was, by the way, I think like your strength is insane, and I'll just echo what Lisa said, because as you were talking, I was thinking about I don't know how I made it through high school. I really don't. I dropped out in the middle of my sophomore year. I went to 3 different schools. I found one that was amazing, and it had an amazing theater department, and that distraction of being able to engross myself in something that was meaningful to me, I think pulled me through it. But at a certain point, OCD becomes so malignant and so strong that even like the thing that you love is not enough to carry you through it. So like I did graduate. I graduated from an amazing private school. My parents will tell you it was like the luckiest thing ever. We have no idea how. I went to college for 3 months and then dropped out because of the OCD. And the college was like one of the top acting schools in the world. They accept 20 people out of thousands that have auditioned. And it killed me to drop out. It killed me to leave after 3 months, but I was convinced I had a brain tumor because I had a dizzy spell and couldn't stay. And so like, I know in that moment, or in those moments, there's no way I would have been able to talk even a year or two after. And even now, when people talk about their college degrees and stuff, I'm kind of like, yeah, I didn't graduate from college. And I'll make a joke or something, but deep down, it still kind of stings. I know it doesn't make me who I am. It doesn't define who I am as an individual, but it still sucks. Like I still would have liked the experience. And so I just want to point out the bravery, that it takes to talk about your high school experience, talk about what you're going through right now. It's so fresh and so new for you. So kudos to you, Shira.
Yeah. I remembered what I was going to say.
Go ahead,
So it was something, Kyle, you triggered it actually, and something that you said. So, sometimes when people go through ERP, there are different ways to do it. And you guys, Shira and Kyle, could probably speak to this too. You can really full on go through it and like go after your OCD like Kyle did and he described. Or you can kind of go through kind of kicking and screaming. And one of the other things I wanted to say is that, I know that sometimes people I'm seeing in the feed, sometimes people are like, oh, I did ERP and it didn't work so well or whatever. Yeah, sometimes. And sometimes that's because it's how you approach it is going to amplify it. So the more you're really willing to experience whatever shows up, let it in, let it scare you, the better you're going to do. And so that was something, maybe you guys can talk a little bit more about that and your experience of that.
Kyle, do you have thoughts?
Yeah, I do have a thought. On the feed, I saw a counselor that I saw when I had inertia last year, and when I was working with her, I was doing exactly what Lisa just said. I was kicking and screaming, and I wasn't taking in the exposures. I was just kind of grinning and bearing it, and not realizing what I was doing, what I was fighting for. I was doing it because someone was telling me to do it, and it just flat out didn't work. And like, I'm a person who had already been through OCD treatment, and I knew that ERP was the way to go, was the way to deal with my problem, and it still was hard, and I still phoned it in for a pretty long time, even though I knew I was going downhill. And only when I started to think to myself, like, okay, I've had enough, and I really put my mind to it, that's when I was able to get back to normal functioning.
Do you think having already gone through ERP gave you a false sense of security that you totally have this?
Oh, for sure. I think I think one of the reasons that I relapsed really quickly was because I had been through ERP. I felt very comfortable going into 8th grade, 9th grade, 10th grade. I didn't really have anything, and I let my guard down. And it came up pretty quick.
Yeah, for sure. And I know people are asking a lot of great questions. We will try to get to them. Kyle and Shira both submitted some things that they want to talk about, and I think it will hopefully answer a lot of the questions that you're asking, and then we will definitely get to questions. But I do want to first touch on, Kyle, you had talked about, when your parents, or when you first started experiencing symptoms, your parents were like, we have to do something about this. How important in your recovery was your parents' involvement?
It meant everything. My parents were facilitating my OCD at the very beginning, and they were kind of helping me get out of the anxiety because they didn't know OCD, just like I didn't know OCD at the time. They were reassuring me, like, really very frequently, and when they took the time to learn about OCD, and credit to my parents because they read everything that they could about OCD, and they really knew their stuff when I was going through it. And when they stopped reassuring me and like trusted Moritz and gave me away to the treatment and said, like, you're going to do this, that's why I was able to get out of it. It was tough love, and it didn't feel great in the moment, but looking back, I appreciate it so much.
For sure. We always talk about, first of all, Kyle, I want to give you a shout out for having in your phone, on your home. That's pretty amazing. That was a joke. Anyway, so it was a terrible joke. Just don't let me talk. Stop. Kick me off, Fran. So Robin, I always say when I'm talking about this that OCD is a family disorder. It affects the entire family. I know that my parents weren't married to each other; they were married to my OCD, and lived around it. How important is addressing the family as a whole, not just the sufferer?
I'm sorry. Oh, was that directed to me?
Yeah.
Oh, I'm so sorry. It just bleeped out for a second.
Oh,
Yeah,
sorry. Yeah, Robin. I
either.
said Robin.
Yeah.
Oh my God! I thought I said Robin. I'm so confused.
Yeah.
Okay,
No. We have some internet issues, so sometimes there's a little lag. Yeah. So I'm really always amazed when I'm doing an initial evaluation and I'm asking about their previous treatment history, and I'm hearing that an individual has been in treatment. Of course, they're doing talk therapy and relaxation, think a happy thought, and, we'll just forget about it, all things that are totally ineffective. But they've got a child in treatment, and I'll say, well, what has your level of involvement been? And they're telling me that they haven't been involved and they don't know what they're talking about. And I'm thinking, well, how is that? Because your child lives in the family and it's a system. And it's not about dropping your child off and fixing them. It's about working the entire system. And so I just think it's so important to piggyback on what Kyle's saying, in that you have to work with the whole family. And there has to be an acceptance of what is going on. I have many parents who are like, don't diagnose him. Don't say he has OCD. I'm afraid he's going to be traumatized by it. I'm afraid he's going to be bullied. And really helping them to understand that, it's interesting, because if you have a cold, or you have high blood pressure, or the flu, or some other, like we can call it that, but we can't say we have OCD as if there's something wrong with you. And really, one of the things that I do when I first work with an individual or a family is I really do that psychoeducation to help them understand this is what this is why this is happening. I'm going to talk about the cycle of anxiety and the importance of treatment, and treatment now, not to wait, because while I have heard many cases of people who say, when I was younger, the OCD went away, but then it popped up again. Well, we want that to stop. And not just helping the parents to understand and accept the diagnosis, but helping them to understand, as you had talked about, Kyle, how reassurance is harmful and how they can support the ERP process, which is critical with homework assignments. It's great that we can do the exposures in the facility or the office setting, but they have to generalize those to their natural environment. And so helping the parents to understand that, once your child goes into ERP, that's a priority, and they have to support doing those exposures, doing those homework assignments, so that you can kind of stay on the clip and keep moving forward. Likewise, it's so important that, siblings are educated as well, because there's so much teasing that goes on. And, once you are invalidated, not just once, but repeatedly by either friends or family, it makes it really hard to engage in treatment. So everybody's got to be on board. Everybody's got to work together, and everybody's got to support that process. And that's what really helps to take a lot of that stigma out that all of us are working on trying to promote. And that is that you are not your OCD. You have OCD. You are a person that has this condition, and again, that it's treatable. But the family component for us is so critical in the treatment, in the effective treatment.
Not only that, but absolutely, Shira. Interrupt me anytime. Go ahead.
Sorry.
No. I mean it. Go ahead. Okay.
No, I just wanted to say, sort of along those lines, that and sort of that idea that OCD is a family disorder, is that yes, it's the kid or the person with OCD that's having a lot of anxiety, but the parents' own anxiety tends to feed off that anxiety. Parents, I will say 99.9999% of parents don't like to see their kids suffer. Yeah. They don't, and it's painful to watch your kid go through something like this. And just like we get treatment for our OCD, parents should be getting help dealing with that own anxiety and figuring out how to coexist and how to have those anxieties coexist with each other. And I know for me, one of my big issues when I was getting ready to go off to residential was I had horrible separation anxiety from the time I was little. Awful. And the first time I went to the OCDI junior, I refused to do residential. I just flat out refused. And I did 2.5 months of great ERP work on emetophobia. But it was outpatient, and I didn't get to address some of the deeper issues. The second time when I was committing to residential, my parents asked, we live in Texas and the OCDI junior is in Massachusetts. My parents asked, when can we see Shira again? And Lisa said, go back to Texas. We'll call you. We'll call you when you can see her. And I got to talk to them once a week for 30 minutes for weeks and weeks and weeks. And I got over my separation anxiety. But there's always this pull and this natural pull for the parents to do a certain thing, to try to protect, to try to accommodate. That's not necessarily what the best thing for OCD is. So I really think, and I know my parents feel the same way, that involving parents in treatment is really integral to recovery for kids and teens. I just wanted to add that.
I'm glad you did. That was beautifully put. And I relate so much to your experience. I mean, it's unbelievable. I was the same way. I was scared to death. My dad had to drop me off at residential at the OCDI adult. I freaked out when he left. They took my phone away because I was calling my parents 300 times a day. And in my mind, it was like, if they just answer, I wouldn't have to call them so much. You know, they're like, no, it's you. I'm like, no, it's not. She just has to answer. So I totally relate. I totally relate to you. Thing to add with parents, Lisa, is like also, you know, yes, ERP and OCD treatment is completely counterintuitive to parenting. We know that, right? And we can explain why for sure. But the other thing is, and I get this in so many emails, is that parents always ask me like, what do I do? What should I say? How do I deal with? And it's like, I can't emphasize enough how important it is to take the guesswork out of it. You don't have to put the burden on yourself. You don't have to try and guess your way through this process. Just like the therapist is in helping the person with the individual with OCD navigate decisions, they can do that for the parents too. How important is that?
That's really, really important. You know, and I think I want to echo something that Shira said. It is really hard for parents, and it feels so counterintuitive. And it's and just to back up a little bit, it's a really normal human response. Parents out there, if you're listening, if you don't know about OCD and how it works, it's really normal for you to accommodate, right? Because that works, right? In the sense that briefly, maybe it helps, right? And maybe it helps you maintain some family routines and things like that. But in the long run, it's really unhelpful, right? Because it basically lets OCD rent space in your house, right? And it makes it okay for it to stay. And it is so, so heartbreaking, I think, for parents when you really, you know, see them doing the hard work of this and pulling back the accommodation. And the thing is to increase, there's a couple of ingredients that you should always, might be useful for parents to hear and remember, right? Is you can always empathize with how hard this is. And just remember too, like I know that parents think different things. Some are worried about the anxiety. Some feel angry at kids thinking, is this something they're doing on purpose? Why can't they just stop it? Especially if they have not had, like Robin has described, that really good psychoeducation about OCD. So you see, you see a mix of things. And so just remember that what the kids are experiencing, that is their truth, right? And they are doing the best that they can, and they need you. They need you to stand for them, and they need you to let them find their own strength by pulling back on the accommodation, right? So something like, I can see how hard this is, and I know you really feel like, or your OCD really needs me to help you, and I know you can do it. You've got this, you know. And like just the same way Robin described a little earlier, like that we work with hierarchies and we work with sort of lower hanging fruit first, and then we work our way up. You can do the same thing with pulling back accommodations. And for parents out there who are listening, whose kids might not be willing to come into care, right? It is so hard. There are programs out there that are evidence-based programs, like the SPACE program from Ellie Lebowitz at Yale, where you are going, Kyle, to Yale. So maybe you'll meet him, maybe you'll run into him at some point, that are just for parents. And they are specifically to teach you the skills that you need and help you kind of systematically pull back the things that you're doing. So I hope that's helpful.
Shira, you had something you wanted to add? I saw your mute come off.
I can't get away with anything. No, I was just going to say that my parents call that tapering back on accommodations. That was literally all I was going to add, and now I'm going to go back on mute.
Okay, bye.
And your mom just said, you know, that she recommends John Hirschfeld's book, When a Loved One Has OCD. We give that out all the time. It's a great book, too. So
Sure.
just
Robin?
a little plug for that.
Yeah, I just want to piggyback on Lisa because, you know, it's really painful when I'm in a session with a parent or parents and their child who's struggling with OCD, and they start saying things like, you know, I think they're just attention seeking, or, you know, I just think they're trying to get out of doing their schoolwork or, you know, their chores. And, you know, it's just one more thing to be aware of, that there's really a difference between a child who's oppositional and avoidant versus a child that has OCD. And that's where that education is so critical. And I don't know, Kyle and Shira, if you guys have been in a place where you've experienced the invalidation of your OCD, meaning your fears, and them being pawned off as some type of other behavior in which you're trying to use that to get out of something, or attention seeking. And I just think it's so important, and I think that we're covering so many different aspects here that are really helping parents, or even individuals like Kyle and Shira, who might be listening, to help better understand how to talk to their parents, or to go to the IOCDF and educate themselves. Because I don't think anything could be worse than when you are scared and you're frightened, and someone is saying you're selfish. You're in the shower for 2 hours because you don't really care about anybody else. Do you realize how disruptive it is that I have to stay home and homeschool you because you can't go to school? It's turned the whole family upside down. And those things are so damaging to a child. And it could further perpetuate their inability to advocate for themselves and to seek help because of that invalidation and the shame and the embarrassment that goes along with the compulsions and rituals that people are doing. I'm sure Kyle and Shira has got to be pretty indescribable as well.
Yeah, for sure. And I also going to urge Kyle and Shira to take a look before you guys sign off at all the comments. If you're not reading them already, there's a lot of support for you guys and talking about your bravery and how far you've been. So definitely take a look and read. But before we move off this parents, I mean, the parent conversation, Talia Johnson. Sure.
I have a question for Kyle and Shira. You guys, here's what I want you to talk about, if you're willing. What did you need to hear when you were struggling, right, from your parents? Because I think that coming from you might be really helpful to the parents who are listening. What did you really need to hear? Not necessarily what did you want to hear, but you could talk about that too. But what would have been important for you to know?
I have two thoughts. My dad would always tell me that he wished he could feel it for me. And he would hug me and say I know this is terrible and I wish I could take away your pain, but we can do this. And I think that empathy, it goes a really long way. And also just the thought that we can do this, we are going to get through this. There is a way out of this. There's a therapy. It's proven. So let's go. That helps a lot. And also, this is probably just echoing points, but I can't imagine how difficult it would be to be a parent and watch your kid struggle. But I can't emphasize how important it is that you don't reassure. It's going to be awful to watch your kid want reassurance and you not be able to give it to them, but that's the only way that they're going to see the other side. That kind of very, very tough love that is super counterintuitive is really the only way that you can help your child, or the best way you can help your child. And just love them all you can.
My answer sort of, at first you kind of left me kind of stunned and not sure how to respond to this, but I kind of figured out suddenly what I think is really important to say. And the first thing is just to reflect and echo what Kyle is saying, that I think, and I just want to say, if there are any teens watching this, I know I'm lucky enough to have parents who were just unbelievably supportive and did everything they could, and I'm so grateful for that. And I know that not everybody has that support, and I just can't imagine having to go through all this and not having it. So I just needed to say that. But also, I think on top of the empathy, there's the saying, actions speak louder than words. I don't think that's always necessarily true, but I think in this case, parents, show your kids you care. I think educating yourselves. I know it's hard. Educating yourselves is important, and my parents reaching out to every OCD therapist they could, getting on every waiting list they could, and I know it's not possible for everyone. I'm so sorry for that, but my parents doing everything they could to try to get me into treatment, calling people. Because sometimes when you're so deep into OCD, a lot of the times you can't hear what they're saying to you, right? They could be giving you reassurance, or they could be not giving you reassurance. They could be leaning into an exposure. They could be saying, I love you, I'm here for you. And you know what? Sometimes you can't hear that. But you can see them taking steps. And I think that's really important. I think, yeah.
I love that, Shira. Thank you, Shira and Kyle. And I relate to that too. I was a 30-year-old child, unable to do anything for myself. And my parents, thank God, were, supportive, as worn down as they were. I think 2 quick lessons here as parents. Number 1, advocate for yourselves. Know that you should be a part of a treatment. There was Talia wrote down here at 2:49 p.m. She said, I wish every practitioner felt that way about involving parents with kids. We had a very prominent clinical psychologist from New York tell us the opposite and did not involve us in exposures. It was difficult for my team to go through them alone. We weren't involved or informed about the exposures at all, and that's unfortunate. So don't be afraid to advocate for yourselves. If you go to the IOCDF website, there's a great article on questions to ask an ERP therapist when interviewing them. Make sure that they fit your needs once you're educated as to what you need. Second of all, Kyle made an interesting point. Just when he said love your child, it really resonated with me, because there's a huge difference between loving your child and hating their OCD. And this also comes with education, but this idea that your child is not OCD, that OCD is disorder. And when you're doing the hard things, when you're making your child cry because you're not going to reassure them, that's punching OCD in the gut. That's not punching your child in the gut. And being able to separate that and being able to understand that you cannot accommodate OCD and love your child at the same time really helps this whole process. So I actually have a question for Shira and Kyle, and then actually if you guys don't mind, I appreciate everything you wrote out, but we're getting to it. We have a lot of questions here, and I want to try to answer some of these questions. So my other question to Kyle and Shira, which is sort of the opposite of what Lisa said, was, I can't tell you, and I'm sure Robin and Lisa have experienced the same thing, how many emails I get from parents going, my teenager has really terrible OCD. He's been diagnosed. Maybe he's been to treatment once or twice. He has no motivation. We can't get him to go. He refuses to engage in treatment. I'm just watching him suffer. I don't know. How can we motivate him? What can we do? What are some things that you would find beneficial, in helping motivate you to move toward treatment? I'll throw it out to you. Whatever mute goes off first.
Beat you. So while we're talking about parents, just another thing came to mind that I really liked. My dad used to do exposures with me. Like, whenever I would have to touch something I didn't want to touch, he would touch it with me. And like, for some reason that made me more excited to do it, knowing that someone was going through it with me. But on the topic of motivation, one thing that really helped me and that really got me motivated was remembering or like writing down all the things that OCD took away from me. And like writing down like my phone, because I couldn't touch my phone for a year, and I really, really wanted to, because I was just in 7th grade and like obsessed with texting. And writing that down and thinking how that little voice in my head took that away from me, that got me really like upset. And it made me want to fight my OCD. So I think it sounds kind of crude, like reminding them of what they're missing, but your child, they're missing out on their life. So remind them of what they're missing, because there's a whole world out there that OCD took from them. And when you realize everything that OCD took from you, that's when you want to start fighting it.
Values and goals, baby.
Yeah, I was just going to say, that's like a very ACT piece, right? Is thinking about the cost of engaging in all of those rituals. What is it taken from your life? And we do that routinely at the junior and at my clinic. And I think it's a really important piece, because, if you think about this, like if you really want to drive home, and people are not their OCD, they're never their OCD, but to really say, I am fighting to get my life back or build one that I really love, that drives that home, And so you might be much more willing to take some steps in that direction if you keep that in your mind as you're doing this very hard stuff that you're going to be asked to do and that you're asking yourself to do.
For sure. That was a huge game changer for me, is identifying the things that I was missing. Go ahead, Shira.
I agree wholeheartedly with everything that Lisa and Kyle said. I would just like to add that in addition to writing down what OCD is taking from you, write out or encourage your kid to write out what they want out of their life. Because when you're sitting there and trying to work up the motivation to do a really hard ERP or do something that your OCD is just screaming at you not to do, a lot of the times you think to yourself, why am I doing this? Because OCD takes away everything you care about. And when you're left with that feeling of not having anything, there's no motivation often to do those really challenging ERPs. So I think it's really important to remind the teen or remind the kid, remind your kid that they're in there, right? They have goals and they have dreams and they have things they want to accomplish. And sometimes it's hard to see that. And of course, when and I know it's heartbreaking, especially for parents to hear, of course, when your life feels like it's been reduced to this, of course it's hard to do ERP. Of course you don't want to seek out treatment, and just validate that. That's important. Like, of course you don't want to do this. But look at everything you could have if you did.
Was it helpful to connect either to Kyle or Shira? Was it also helpful to connect with other people that had OCD?
Yes.
How come?
There's a connection that I feel with other teens, other people my age, and just people in general with OCD that I don't think I'll ever feel with anyone else. Because this is something that you live with. It's a constant state, whether it's murmuring in the background or whether it's screaming at you. This is something that you live with constantly. And to meet someone else, to meet other people who know is life-changing. I made some friends in the OCDI Junior. I saw a question, where did you go to residential? I went to the OCDI Junior in Massachusetts. I made friends there that I'll have for my entire life. I was FaceTiming with one of them this morning. And there's a power and a motivation and a we're in this together sort of that comes from connecting with people who also have OCD related disorders. Yeah.
And that's what's cool about, go ahead, Kyle. Yeah, oh, I'm so confused. Go ahead, Robin.
I just wanted to throw something in about, I've seen through the thread that a lot of people are saying, oh, it's so hard to think about, my child having to do ERP and, the pain and the suffering that they're going to go through. And I just think it's so important that you look at the suffering that they're going through right now. And the longer to get treatment, it's going to prolong their suffering. And, if your child was medically ill and the doctor asked you to do a treatment that perhaps, was going to make them sick to their stomach, like, you wouldn't think twice about it. You would just say, honey, this is going to make you sick, but this is what you need to do. And it's similar in the sense that it's going to be uncomfortable. It's going to be awkward. But, OCD is a bully. It has its own mind. And the more you feed it and the more you avoid it, the worse it's going to get, like that snowball that just keeps going down the hill and getting bigger and bigger. So know that there is a prescribed treatment that can be very helpful and to end that suffering, and that there has to be, as Kyle and Shira have talked about, there's going to be some suffering in the treatment to get to the other side. And in the thread, I saw a couple people note that, they have gone to these sort of world-renowned doctors with big names. And I have to tell you, it's not about the name of the doctor. It's not about the article that they've written. It's about their training and their expertise. And I think that this is where ERP gets the bad name, is they're not vetting the doctor. And I think that sometimes people will think that that's rude and that's inappropriate to ask them, where did you go to school? Where did you get your training? What is the treatment modality? And that's what you need to do, because we need to avoid people either getting burned out on psychotherapy, talk therapy, relaxation, yoga, thinking a happy thought, so that then they're not going to continue to seek help, because that therapist has said, yeah, I can help you. Yeah, this is what I do. I mean, go to Psychology Today. Oh my gosh. If you go in a profile, they note 50 different disorders that they can do. And I'm thinking, wow, they must be really good because I can't do that,
I couldn't do that either. Exactly.
Yeah. So go to the IOCDF, go to somebody whose profile indicates that they do anxiety and not 30 different things. Because nobody can be that good at that many different things. Like, you don't go to your eye doctor if you have a stomach ache. Like, just because they're a doctor doesn't mean that they can do everything. And so feel free to ask somebody about their experience. And if they get offended, then that's not the place that you want to go, because I'll tell you what, and I know, Lisa, you're right on board with me.
I am so on board with you. You have no idea.
Yeah, I have no problem telling people. Yes, thank you for asking, because enough people don't. And this is where I want to give you the confidence that I know what I'm doing, so that then that leads to doing the treatment. So I think what's so cool is, as we're seeing in the feed, we have people coming all over the world, Nova Scotia, India, Ireland, all across the United States.
So cool.
Again, a shout out to you, Ethan, the IOCDF, for doing this, because we are targeting people that we otherwise would not be able to target. And if we reach one person, like, our job is done. We've done our job for today.
Okay. And can I just add one thing to that? Because I saw, as you were talking, Robin, I'm seeing, like, people are asking, like, does anybody know teens who have had success with ERP? And here's the thing, and I really hope people hear this. Everything Robin said, I want to underscore like 3 times. And what you want, parents or kids, if you are looking for therapists, is you want someone who does exposure and response prevention, not just CBT. A lot of people say they treat OCD and they do CBT. And I can't tell you how many kids we have talked to where they're like, yeah, they didn't know what they were doing with exposure. They need to understand the functional relationship between obsessions and compulsions. Another one is they need to understand that compulsions can be cognitive. They can be thinking compulsions that you do, right? And really ask there. And Ethan, I think you sent them to this piece on the IOCDF website about how do you vet a practitioner who really does solid ERP. Now, the other thing I want to say is, and I am so grateful to, and I know, Robin, you are too, like, we get to use an evidence-based treatment. I trust the model. And so parents, if you are scared to reduce your accommodation and lead your kids through it, if you're scared to nudge them into things, please know you can trust the model. It works, right? And when it's done effectively, and when young people really engage in it, and when you as parents engage in it consistently and well, kids make gains. All right. And so that's just wanted to add. And thank you for saying everything you said, Robin.
Absolutely.
I was like, yes.
For sure. And I think that, and I'm going to quickly turn to the questions now, because we need to at least get through a few. But like somebody just wrote, but as a parent, it feels like I am punishing my kids and not the OCD. It's so very difficult to watch him go through any and all of this. And
yeah.
I was going to wait. Go ahead, Lise.
Oh, man. So the only thing I wanted to say about that is it can feel so hard. And it is okay to feel that. And also think about that, because if we, as either clinicians or parents, are not willing to feel whatever shows up for us in the middle of these exposures, right? Because it is hard for us too, right? How are we going to teach kids to do this? So that's a really important piece. So if you're scared of doing this, yes, you will be. And you're going to doubt. Yep, exactly. Lean in anyway. Because as Kyle and Shira have said so beautifully over and over, it's the only way out for your child and for your family. Now I'll shush Ethan, sorry.
No, don't try. But that's all. No.
Sorry, Ethan. Can I go?
Yeah, of course.
I want to add on to that. You're not obviously hurting your child. You're attacking their OCD. But if this provides any solace, my parents did that to me. I'm sure they felt like they were hurting me, and they weren't hurting my OCD. But I'm here now. I'm a kid. Looking back on it, I cannot thank my parents enough. And I guarantee you, your kid will feel the same.
Yeah, I can say the same thing. Like, I think a bit of healthy reassurance is okay. Like, to parents, like, looking back, for every time my parents didn't accommodate, didn't reassure, every time my parents kicked my OCD in the gut, they weren't kicking me in the gut, and I see that now. And even if your kid can't see that in the middle of it, they'll be able to see it on the other end.
For sure. And I went through the same thing, and I think that the longer you've been through it, the longer the OCD has conditioned you, the parent, to do what it wants. And so that's why also the support from the therapist in terms of the parental component is so important, because my parents had to go through days and weeks and months of therapy. And when I was at residential, they were going to therapy. And when I wouldn't go to therapy, they would go to therapy, because they, one, had to learn to deal. They felt a lot of guilt around me, and it was their fault. They had to learn that it wasn't their fault. They had to learn how to cope and deal with the emotions that they felt by not enabling me and reassuring me. Some of my fears were around my abandonment. My parents were going to leave me. My parents didn't love me. So literally some of the therapies where my mom had to say to me, "We don't love you. We wish you'd never been born. We don't want to be here for you anymore." Like, can you imagine saying that as a parent? But they get the education. Well, my mom actually always sucked at it, because she would be like, "We don't love you. Want to come over for dinner? We're having your favorite," which is why I had to go up north and get away from her. But it's hard, right? So it's like, can you imagine? She needed a ton of support and treatment and therapy to help even get to a place to no longer accommodate the OCD. So that's also where the therapeutic component comes in as well. Robin, do you have something to add?
No, I think that everybody's really covering just the importance of not just the individual getting treatment, but the family component. And, I was just thinking about some of the people that I've worked with where, the patient, the child or the teen is on board, and we're actually having to work more with the parents because they're not supporting the homework, or they're continuing to accommodate. And like really having to sit them down and say, "Look, I can't do this without you. Your kid is on fire. Like, they're ready to do this, but you have to do your piece too." And the frustration I think that we feel as clinicians sometimes when you have somebody who's super motivated and you don't have, the parent who is supporting that process, again, lending to that importance of doing those family sessions and including them. And I think being really firm with them. You've brought your child to me. You must trust me at some level. So you have to trust the process. It's not about fixing your child. It's about looking at the entire system.
We could do like 8 of these with team. I have so many questions of my own. I have so many questions that Kyle and Shira wrote. There's a million questions in the feed. I got to just get some questions in the feed, or I'll lose everything. Nicholas at 2:20 p.m. This is a pretty quick question. Is there a link between OCD and procrastination? Shira. That's at 2:20 p.m. Fran, from Nicholas, and he has a bunch of squares after his name, so we can find him easily. Thank you, Nicholas, for the squares. That's awesome. See, that was it. That was the secret. Is there a link between OCD and procrastination? What do you think, Shira?
I mean, I'm not a clinician, so don't quote me on this, but I definitely think there is. I don't think procrastination is only caused by OCD, but I definitely think a lot of my procrastination has been because of OCD.
What do you think? Why do you think that? Here's the thing: you probably know more than most clinicians. So why do you think that is? Is the compulsion? Go ahead.
I mean, I think procrastination is a form of avoidance, and avoidance is a ritual in itself. I mean, if you're anxious about doing something, your instinct is to put off doing it. And a lot of the time, whether it's procrastination around homework, if you have like academic perfectionism, or if it's procrastination around doing an exposure, even if it's a procrastination about like making a phone call, like it's procrastination, I think is an outward manifestation of anxiety.
That's awesome. And also the fact that if you're engaging in compulsions, you're probably putting off the things that are important to you or the things that you need to do. Yes. So, that can also appear as procrastination as well. I'm going to jump through these. Kyle, actually, Fran, Laura at 2:27 p.m. Laura Coons asked Kyle or Shira, were you in public school, homeschool, ? Homebound? Did you or Shira have IEPs? We are struggling with our district. Any thoughts as to accommodations?
I was in public school, and I did not have an IEP. But my public school was very nice about it. They let me go out of school and kind of come in early and do my homework when I needed to do it, take tests as I needed. If you're struggling with the district, I don't think we even approach the district. I'd go to the teachers. That's what we did.
Say that one more time, Kai. You quickly, where did you go?
We went straight to my teachers and worked
Okay.
out with them because they knew me. They knew what was going on. They could see me struggling.
It's tricky to work with schools too, because accommodation in schools means something very different than we mean here when we talk about accommodation, right? And so educating schools is, and there's a great, I want to give a plug for the Anxiety in the Schools page on the IOCDF. There's great resources for school counselors and teachers and things like that about how you can support your students with OCD without, so giving accommodations without accommodating in the unhelpful way that we think about.
For sure. And lots of you. Absolutely, Rob.
Sorry,
yeah,
Ben. I just want to throw something out because I also get parents who say, oh, the school would never let them miss school for treatment. And, I don't know if there's different laws in different states, but here, by law, they cannot, the school cannot prevent a student from getting the help that they need for mental health issues, just like they can't for medical issues. So parents, if you're listening, the school has to accommodate. And, for those of us that are ERP specialists, we can write a letter to the school in whatever way the parent or the child is comfortable. You are not required to give specific information. You do not have to say that they're OCD. You just have to say that at this time it's medically necessary for your child, the child to engage in treatment, and this is when they'll be in treatment. And I think that's really important. I think just really emphasizing that it is more important that if your child is struggling with OCD, that you get them early intervention and not focus on your fear about them missing school, because ultimately the consequences can be so much more devastating than just missing a period of time in school, which most kids can make up.
For sure, without a doubt. And again, Shira and Kyle, I'm going to urge you to go through the comments. There's so many people saying, love you, thank you, you're so brave, which is all 100% too. Robin, I'll throw this out to you. Melissa Little at 2:33 p.m. Is there any way to avoid the escalation?
Wow. I think the message that we're giving is early treatment, educating yourself, knowing that there is treatment out there. Reaching out to professionals who know what they're doing. Take the time to find somebody. Don't get help from somebody just because you feel like there's nobody else in the area. I mean, we are in a wave of telehealth now, and ERP is hard to do in vivo, in person with somebody. But certainly if you're super motivated, it can be done via telehealth. And the sooner you get treatment, the better. And that being said, I just want to piggyback super quickly on the concept of medication. Many parents are terrified to think about their child taking medication. And there's many people who can do ERP without needing to take meds. But there's many cases also where medications can facilitate the ERP. And again, like going to a therapist who has expertise, vet the psychiatrist or PCP or pediatrician, whoever it is, that's okay. And if they get offended, that's not the one for you. Those of us in this community are happy to tell you why it is we think that we can help you. And if medications are needed from somebody, an MD who knows what they're doing, then please consider that, because the idea is it's only going to aid in your treatment. It's not designed to hinder it.
Absolutely. Just looking through some of you guys are advocating. Again, I actually urge everyone to read through as usual, everybody's advocating for themselves. There's great comments, links, posts, and a lot of mentions for Lisa's book, Stuff That's Loud for Their Teenagers. There's multiple links for the book throughout the comment thread. So I urge all of you to go.
Ethan,
also, yes,
did you see the comment Jeff is posting? And he said, can we please talk a little bit about the plans for the online conference? Because I'm on the planning committee for the youth conference for IOCDF, and we are going to be addressing a lot of these issues and a lot of these questions that you guys are having on the feed. among them, how do we help support young people going back to school post-COVID? So that's something that we, so some of these people on the panel will be involved, I think, in some of those things. So please remember, IOCDF will have a conference this year, and I hope all of you guys who are listening decide to go. It's online, so really you can go in your jammies. What is better than that? So we will be talking about some of these things.
And I'm actually going to ask if Jeff is watching. If Jeff Szymanski, Executive Director of the IOCDF, is watching, I'm being told, I'm getting it in my ear. I feel like Ryan Seacrest. I'm being told that I'm being told that there is a so for those of you that don't know, there's no physical conference. We are making it all virtual this year. There's going to be amazing programming. It's going to be just like the in terms of content and programming, just like the physical conference in terms of tracks and content and panels and questions. And so more information will be coming on that. But Jeff, I honestly don't know. Apparently there is a kids and teens online conference that the foundation is planning that is separate from that particular conference. And Jeff says, I'm watching you, Ethan. Thank you. So Jeff, if you quickly want to post quickly about that kids and teens conference in the thread, I just, I missed that email. So if you want to quickly, while making a BLT, great. So if you want to quickly just write in the comments what that is, so everybody knows, that would be awesome. Because
can you post pictures of the sandwich also?
And post pictures of the sandwich. Okay, he's saying he's gonna send forwards at a time. The kids and teens. Let's see here. The kids and teens conference will be in August. Lisa knows as much as me.
Yes. So it will be in August. Jeff, if I forget anything, just let me know. And what we want to do is two things. One is make a place for young people and their families to gather. It'll probably be 2 or 3 days. We will have programming with youth who are teaching, who are providing support groups, who are doing education. We'll be doing workshops and things like that to disseminate skills, things like that. So it's going to be discussion groups, lots of discussion groups. If there's anything I'm forgetting, just post, because I'm sure there's a lot we're forgetting. But we're in the middle of planning this right now. And really, if you have not been to an IOCDF conference, or if you've always wanted to go and couldn't afford it, or if it's just too far away, please, now is your year. This is, and I would love for Kyle and Shira to talk a little bit about what it is like as a teen to attend. What did it do for you guys going to the conference?
Can I talk? Can I talk? Hello?
Oh, yeah, totally. No, Lisa's in charge. I've handed the buck to her.
Oh, cool.
Okay.
I didn't know I was in charge.
The IOCDF, I mean, quite literally saved my life and changed my life. That's where I met. My first conference was Chicago in 2016, but in 2017 in San Francisco is where I met Lisa, and where I attended the teen panel that inspired me to go to residential. And I also happened to meet my closest and best friends in the world at the conference. I mean, it's phenomenal. And like Lisa said, if there was anything holding you back from going in past years, whether it be financial or just geographic or whatever, like, this is your time to go. I mean, everything that's going on right now is horrible. And I feel a tremendous guilt in saying there are any upsides to it, but I'll just say that we have an opportunity. You have an opportunity, especially if things are especially hard because of what's going on with COVID, to have that extra help.
And I'm going to say, go ahead, Kyle.
Yeah, I was just going to say, I don't think you can leave one of those conferences and not be like uber motivated. Like, if you are already recovered and you're just doing maintenance at that point, like, you feel an urge to make sure that you're on top of it. And if you're not recovered yet, I was like kind of like halfway there, still in the middle when I went. And you leave that conference and you want to attack your OCD. It's so beneficial.
Thank you, Kyle.
And I think too, just to add in something really quick, like, if you're somebody who's struggling with doing the treatment because it sounds so scary, or you're a parent who's really struggling with thinking about getting your child into treatment, like, this conference, it will fix all that, because you'll be with the top experts in the country. You'll be seeing people like Kyle and Shira who are going to be talking about their experience, and it is a game changer. And people with OCD can live perfectly functional lives, and we never want anything to be in charge in our lives but ourselves, and definitely not OCD.
Absolutely.
If you
Go
think
ahead,
you're
Shira.
getting a lot of information right now, just conference is like 72 hours of that.
It's awesome.
Yeah.
And there
It is
are,
awesome.
somebody asked in the feed, is there a parent component? There are many parent components. And if I could say, this is one of my, like, if not my number one favorite conference to go to, because there's so much love there. And there's kids like Shira and Kyle. There's other parents who are our parent mentors. There's people like Ethan. Everybody is there for one purpose, and it's to get good care to people and to make a community. It's a really great experience. So please think about going. Please do.
Yeah, it is. And we're going to do our absolute best this year to give you as close as an experience as possible to the physical thing. But for sure, the content, the information, the passion, the emotion, all of us, that all will be there without question. They'll just, no hotel. So, all the love, all the magic, no elevators. So we're unfortunately out of time. I want to give Kyle and Shira sort of the last word in terms of final thoughts. Kyle, any final thoughts that you'd like to impart to the viewers today?
Okay. Parents, it's tough. I can't put it another way. It's really difficult watching your kids struggle, but that's the way they're going to get out of it. And if there's a teenager listening, OCD is not your friend. It's going to drag you down, and it takes away your whole life. And I know, trust me, I know fighting it is so hard, and it seems so real. Everything about it makes you want to listen to it. But at some point, you're going to have to realize that it's taking away all the best things in your life, and you got to fight back. And you can. That's my favorite part about OCD is you can beat it. It's lying to you.
Awesome. Thank you, Kyle. Shira.
You're putting me on the spot. Ethan likes to put everyone on the spot. I would just, I want to echo everything that Kyle said. And I'd also like to sort of return to something that I find really helpful is sort of the ACT kind of concept of if you're a teen and you're struggling with motivation and you feel like you're stuck in this and you feel like there's not another side, I'd encourage you to take 10 minutes to sit down and write everything, write about what you want your life to be and what OCD is keeping you from and what you want to get back. I also want to just say, if you're a parent and if you're a teen or a kid, you're not alone, and OCD has this effect of feeling incredibly isolating and making you feel like you're the problem or that it's the problem or that you're alone in this. You're not. I mean, the conference is one of the things that's incredible about the conference is that it's just like a slap in the face in a good way. It's like, you're not alone in this. Like here are 2,000 people who are going through all the crap with you. Excuse me. Yeah, just remember that. Recovery is possible. It's hard work and it's not linear, but it's possible. Also, I know the IOCDF put my email and some of my social media in the comments, but if you're a kid or a parent and you ever want someone to talk to, please reach out to me. I'm always eager to help.
Yeah. Awesome. Thank you. Thank you, Shira, for that. Incidentally, when you're put on the spot, you do magnificently. So just, start getting used to that. So yeah, there you go. I put you on the spot again, putting you on the spot. Anyway, so with that in mind, that will conclude. I know there's so many unanswered questions. Hopefully we got some topics that did answer your questions. I want to thank Robin, Lisa, Kyle, Shira for joining us. This was a really special town hall for many, many different reasons. And so thank you. If your question wasn't answered or it wasn't answered in the discussions, Fran will pop on the info@iocdf.org email address. Please, please, please do not hesitate to email your question to us, whether it's for just the IOCDF in general, or if you have a specific question for anyone on the panel, we will make sure that they get the question and get you an answer to that question. Or, you can email Shira directly as well if you have a question for Shira, but please don't hesitate to email. Also, if you're interested in what's coming up, you can go to the newly created IOCDF calendar on the website. Fran, I don't know if we have a graphic for that or if you want to put that, but the calendar on the website will show all of the upcoming events. Offhand, I can tell you that this coming Wednesday, we'll be having acceptance commitment therapy in the age of COVID, volume 2. We had a huge turnout last week. We have some amazing guests this week, including this one down here, Dr. Lisa Coyne. She'll be joined by Marissa Mazza and Nate Gruner from McLean. So you'll definitely want to tune into that. As always, I want to thank Fran behind the scenes for building questions and graphics and making all of this possible. And of course, a massive shout out to the IOCDF for all that they do and for giving all of us a platform to be able to support all of us, you and ourselves, and all of us just come together in one giant virtual town hall hug as we have. If you haven't already and you want to be notified about all programming the IOCDF is having over the next month, definitely be sure to subscribe and follow on Facebook, Instagram, YouTube, and Twitter. Good news, just because, we started this stuff because of COVID, but the reality is we are not going to be stopping. We'll be continuing to bring you lots and lots of content virtually as long as we possibly can on as many topics as we possibly can. So also, if you have suggestions or ideas that you want us to address, you can also email those to the foundation. We'd love to hear from you, and hopefully will be a topic coming up soon. So yeah, that's all the latest and greatest. Thank you again to Robin, Lisa, Shira, and Kyle for taking your time. Thank you for spending your Saturday afternoon or late morning, depending on where, or actually some people it's evening. Gosh, thank you for taking the time. As always, I didn't do this today. Shout out to Nikki in Dublin. It's sort of a compulsion that I have to do because she always comes on. I always have to thank her because she's in Ireland. She's my first Ireland friend. Anyway, so until the next time, thank you for spending your afternoon with us. Have a wonderful day. Stay safe, stay vigilant, feel all the feels. Don't let OCD off the hook during this time. Listen, it's so awesome to see Kyle and Shira thriving. It is. I started in this because I wanted people to see that if I could get better, they could get better too. Kyle just said that. Here are two more amazing examples of what happens when you take this head on. If you are here, if you are seeing this, then you are light years ahead of people that. If you're hearing the words ERP, if you are here leaving comments, if you have access, if you know about the IOCDF Foundation website, then you are already so far ahead of so many sufferers that don't know what the right treatment is. So if grab a hold of that, go to the foundation website, click on the links, look at the resource directory, advocate for yourself. Now's the time. Thank you so much. We will see you next time. Everybody wave. Oh, great. Thanks, Fran.
That's hilarious.